I want to transition to a portion of your life where you went through what you probably watched hundreds or thousands of patients go through. And I want to talk about March of 2023. What happened in March of 2023?
Well, interestingly, it started the end of December 2022, actually. I went on a long trip back to Cape Town, South Africa to attend a relative's wedding, my niece's wedding. And when I got there, my family who hadn't seen me in years said, "Oh my gosh, are you okay? Are you feeling all right? You've lost so much weight. You look gaunt." And I'm like, okay,
Yeah.
you know, sort of check that box, think about that and get vigilant. And in fact, I'd lost about 20 pounds.
Wow.
And so when I came back, I went right back into my office work again, but I sort of had in the back of my mind that I should get
Checked
checked
out.
out. Then I developed a cough during the month of February of 2023. And I thought, oh, I just had some bronchitis. I took some antibiotics and I felt a little bit better, but the cough didn't go away. And so I went to get a chest x-ray in
Mhm.
early March, and it showed this gigantic mass in my right upper lobe.
And you looked at your chest X-ray, I'm sure, before the
Well, I remember the
even
tech
read the
saying to
report.
me, "Oh my gosh, you've got pneumonia." Well, I'm like, "Well, let me take a look at my x-ray. Do you mind?" And she's like, "No." And I said, "I wish that was pneumonia."
So you sort of knew,
I knew. I
right
knew.
or left?
Right upper lobe.
Right up or left.
Well, as it turns out, I then had a CT of the chest. It was not just confined to my right upper lobe. It was affecting my middle lobe and the superior segment of my lower lobe. So all three lobes were actually involved with this mass.
You guys, when you're looking at the lung anatomically, there's a right lung, there's a left lung. You can see a picture of the lung behind me. You have your airway, your trachea, which travels down, breaks into the right and left main stem bronchi, and then you have lobes that basically evolve from there. So you've got an upper lobe on the right, you've got a middle lobe on the right, and then you've got a lower lobe on the right, and then there's further subsegments. When you're looking at chest x-rays have 4 different densities that you can see really well. There's metal density, which is your bone, so you can see a bone really well. There's air density, which is black. You have adipose density, which is like a little bit grayish, and then you have soft tissue density, which is more white. Now, the way that I always like to describe it, because I think people understand it better, is the chest x-ray. When you have more white than you should, it's like the only time in the world where being white is a bad thing. And so what he's saying is when he looked at his chest x-ray, he saw too much white in that right lung, especially near the upper lung field on an x-ray, right? And so you have all this white. So you can see it almost right away. And the interesting thing about what Dr. Gibbon is telling you right now is he gets the x-ray. The tech says, "Oh my gosh, you've got pneumonia." Dr. Gibbon says, "I don't have pneumonia. I don't know symptoms of pneumonia. I don't have a fever. I don't have any of that." He looks at that and he says, "I wish it was pneumonia." Why did you say you wish it was pneumonia? What was going through your mind?
Because I knew it was a malignant cancer.
And again, as a physician, somebody who'd been doing it up to that point for what, 50 years,
Yeah.
sort of what's next, what's coming, what needs to be done. And you're thinking about all of these things, right?
Right.
And with cancer, the biggest thing is stage. And the way that we stage cancer is it's based on, first of all, where is it? If you have a cancer in an organ, it's going to be a stage 1 in that organ. Then the stage is based on how big that mass is or how far those cancer cells have traveled. Are they in the lymph tissue, which is kind of the freeway system for white blood cells that cancer cells break into and travel far? Are they in lymph nodes, which are kind of like the neighborhoods of these white blood cells? Again, cancer cells break into these neighborhoods. So if they're in these local neighborhoods and cancer cells are there, the stage is higher, right? Stage 4 is sort of distant, all over the place cancer. Stage 3 is like it's gone a few neighborhoods over, may have traveled a little bit distantly, but it's definitely in a few neighborhoods away. Stage 2 is like you have this big mass. It might be in a lymph node next to where the mass is. And then stage 1 is the mass is just there. When you went through your testing, what did you have done and what stage were you?
First of all, I had a chest CT after that chest X-ray, and then I had an endobronchial ultrasound biopsy,
Mm-hmm.
and then I had staging at that same time, as you have explained, of the lymph nodes. And one of my neighboring, as you've described it, lymph nodes had cancer cells. So I was a stage 3.
An endobronchial ultrasound, you guys, is when we take a bronchoscope. So anybody that's had a colonoscopy knows what a colonoscopy is. It's a video camera through the anus into the colon. You can see the colon very, very well. A bronchoscopy is a similar thing, just in the lungs, right? You actually ultrasound the lymph node and you take a needle through the scope and you biopsy the lymph node. You look in a microscope and you see if there's cancer cells present, which is what he's telling you. And he had that done. Now, as soon as you were stage 3, what did the doctors do next?
As you know, the best way to cure lung cancer at any stage is surgical removal. I had a type of non-small cell lung cancer that would be amenable to surgical resection if it was not that large. It was 9 centimeters in diameter, and if it hadn't affected one of the neighboring
Lymph nodes.
mediastinal lymph nodes. Yeah. I was not at that particular stage a surgical candidate.
Right.
My oncologist told me that the best way to start with this would be to do something called, and you're well aware of this, called neoadjuvant chemo and immunotherapy. That meant systemic treatment with 3 intravenous drugs, 2 chemotherapeutic drugs and 1 immunotherapeutic drug.
Neoadjuvant means like before you have a definitive therapy, a definitive surgery. So they're going to give you these molecules to try to shrink the size of the mass, reduce the amount of cancer cells that are in the system, and then you would go through a surgery.
Surgery, yes.
Now, I want to know, when you get that diagnosis, you know what's coming, you know what's next. I want to know, like, I mean, you've completely flipped. You've gone from somebody that's on the outside looking at people, taking care of them, to somebody that's now in the system, going through all these things. Emotionally, with your wife and your family, I'm sure you went through some things, but from a patient perspective, is there anything then that you take back? You're like, God, I'm glad I experienced this because I want to do this better.
Well, Jamie, the first thing I felt was shocked. I mean, it was an extreme irony as well that a pulmonologist would show up with a stage 3 lung cancer. And after I got over that shock, something amazing happened. I suddenly developed this incredible will to live. My mindset flipped to a survivor type mindset. And I brought up all these survival skills, like not just will to live, but resilience, calmness under pressure, hope, and not despair. I didn't say, oh my gosh, I got advanced lung cancer, I'm done. I didn't approach it like that at all. I went straight to my oncologist, and he immediately started treating me with chemotherapy and immunotherapy with the hope that this large tumor would shrink down small enough that it would be surgically resectable without me having to have a pneumonectomy.